Organs of hearing and equilibrium in the petrous portion of the temporal bone, also called mastoids and organs of hearing. In the ear we have three divisions. You can see here starting here we have the external, the middle, and internal ear. The external ear has the ora or pinna, which is the flap of ear that we refer to. The tragus is the small lip-like area anterior to each EAM, and it kind of acts like a shield or an opening. The canal of the external ear is the EAM, and the EAM is about 1 inch or 2.5 centimeters in length and is part bone and part cartilage. And the mastoid tip is posterior and inferior to the EAM and narrows into the styloid process. The middle ear is irregular in shape. It has air-containing cavities located between the external and internal ear, and it consists of three parts, being the tympanic membrane, the auditory-ossicles, and the tympanic cavity. The tympanic membrane, outlined here in red, is the partition between the external and middle ear. The auditory ossicles are the three bones that bridge the middle ear cavity to transmit sound vibrations from the tympanic membrane to the oval window of the middle ear. We see here the malleus or the hammer, which picks up the sound. It articulates with the incus or anvil, and the incus then connects to the stapes, which is the smallest and most medial, and has the shape of a small stirrup. And the foot plate of the stapes attaches to the oval window of the cochlea of the internal ear. This just gives you another perspective from the frontal and the lateral view. So as seen from the front and then as seen from the perspective of the EAM. The tympanic cavity is divided into two parts, the tympanic cavity proper and the attic or epitympanic recess, which is above the level of the EAM and the eardrum. The tympanic cavity communicates anteriorly with the nasopharynx by way of the eustachian tube, and the eustachian tubes serve to help equalize pressure in the middle ear and is pretty much a direct passage from the middle ear to the throat. Mastoids serve as the second direct communication site into the middle ear, and the mastoid air cells are posterior to the attic or epitympanic recess and the tympanic cavity proper. The attitus is the opening between the attic and the mastoid portion of the temporal bone, and it connects directly to a large chamber within the mastoid called the antrum. And this allows for communication and, unfortunately, infection between this area, the throat, the middle ear. Mastoids are separated from the brain by a thin bone, often the pathway for infection of the brain called encephalitis. And then lastly, that thin plate of bone forming the roof of the antrum, the attitus, and the tympanic cavity is called the tegmen tympani. The internal ear contains the organs of hearing and equilibrium, and it's located within the densest portion of the petrous pyramid and is divided into two parts, the osseous or bony labyrinth and the membranous labyrinth. The osseous labyrinth houses the membranous labyrinth. Looking here at the osseous or bony labyrinth, it's divided into three parts, the cochlea, the vestibule, and the semicircular canals. The cochlea is the most anterior of the three divisions, and it's the auditory portion of the inner ear. And the base of the cochlea is called the cochlear window or the round window. The vestibule is the central portion of the bony labyrinth and contains the oval window or the vestibular window. And this window receives vibrations from the foot plate of the stapes of the middle ear and transmits them to the vestibule of the inner ear. The semicircular canals allow for equilibrium, and each of them is named according to its position, being superior, posterior, and lateral. And each is located at a right angle to the other two, allowing for the sense of equilibrium and a sense of direction. When radiographing the mastoids, we don't do this very often at all. It's rather a lost art, but I do still happen to have the information and wanted to present it to you since the information is not presented in the textbooks any longer. So we won't be necessarily tested on this for you to remember, but mostly for you to be aware. So you can see here we'll use a small collimation. They say to tape the auricle forward. Don't know that that's necessary, but rotate the face. We're going to start basically with a true lateral position, and then we're going to rotate the face 15 degrees towards the IR. So this won't be horribly different positioning than what we've been doing primarily for mandible. So your IPL is perpendicular and the IOML is perpendicular. Your central ray is angled 15 degrees caudad and will be entering 1 inch posterior and superior to the upside EAM, and it's exiting at the downside mastoid tip, and that's what we see here. So another axiolateral oblique projection called the Stenvers, which was one that was pretty well known. On this one, again, your IOML is perpendicular to your IR, but we're going to rotate the head 45 degrees with the side of interest down. We're going to angle our tube 12 degrees cephalad to enter 3 to 4 inches posterior and 1/2 inch inferior to the upside EAM, so centering on the upside but looking at the downside. The AP Axial, which is the Town method, is very same position that we're doing before. 30-degree caudad angle if we're using OML, 37 if we're using IOML, with the central ray to pass at mid-sagittal plane at a level 2 inches above the glabella. And you can see the mastoid air cells laterally. Shuler Method, which we'll talk about for TMJs, but again we have a true lateral position. In this case, the central ray is angled 25 to 30 degrees caudad, entering 1.5 inches superior and posterior to the upside EAM and exits at the downside mastoid tip. Another axiolateral projection called the Arslan Method. This is essentially the reverse Stenvers, but in this case we're going to rotate the head 45 degrees away from the side of interest, so we'll be looking at the upside with a central ray directed 10 degrees caudad to enter 1 inch anterior and 3/4 inch superior to the upside EAM. And again, you can see your mastoid here. Another axiolateral Mayer method, and in the end here an Owen modification, where we're going to rotate the head 45 degrees towards the side of interest and use a 45-degree caudad central ray to enter 3 inches above the superciliary arch and passing 1 inch anterior to the downside EAM. And if we were to do the Owen modification Instead of using a 45-degree rotation and a 45-degree tube angle, we would rotate 30 to 40 degrees and use a 30 to 40 degree angle. The SMV projection is the same as what we would be doing for other positions. Again, seeing here IOML parallel to the image receptor or the table, and the central ray to enter midway between the angles of the mandible.